Okay, folks, we'll have a look at the wrist and the hand now. Remember, we're looking at bony landmarks and muscular structures that actually influence the joint, the wrist and the hand. Okay, so let's start off looking at bony landmarks of the wrist and the hand. These are all of the bones in the wrist and the hand that you need to be aware of. But it's important to keep in mind that these eight, scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid and trapezium, are all within the wrist. They're what are referred to as the carpals. And then, of course, what you would typically consider to be bones in your hand and your fingers are made up of the metacarpals and then the proximal, middle and distal phalanges. So these are, for want of a better word, these are your fingers and thumb, and these are all of the bones located within the wrist itself. If we consider the wrist joint, as I said, there are 8 bones there that you need to be aware of. And we talk about what is known as a proximal and a distal row. Now, this view here is of a hand which is in a pronated position, so palm flat down on a table, for example, and you're looking down on top of that. If you do that, then in the proximal row of the wrist, we refer to as being made up of these 4 bones: scaphoid, lunate, triquetrum and pisiform. In the distal row, trapezium, trapezoid, capitate and hamate. Now, it's important to make sure that you've landmarked yourself. In other words, this is the thumb and this is the small finger. So we talk about digits 1, 2, 3, 4 and 5. So this again is in a pronated hand. In other words, a hand flat on the table, your palms flat on the table, and you're looking down on top of it. Now, one way, there are many different ways of remembering this, is to use a mnemonic. And a common one that is used is Sue loves to party, try to call her, as reference to the bones in the proximal row, Sue loves to party, and in the distal row, try to call her. But either way, in other words, it doesn't matter which way you choose to remember the names of the bones and which are in the proximal and distal row and where they are positioned. Medial, obviously, if you're in a pronated hand that is, medial to lateral in a pronated hand, medial to lateral in a pronated hand. And then, of course, so if they're the carpals that we've looked at, the metacarpals are obviously in the distal aspect of the distal row of the carpals, and we talk about metacarpal 1, 2, 3, 4 and 5, with 1 being the thumb. All right, 1 being the thumb, so this is the thumb, then the index finger, middle finger, ring finger and small finger. Of course, don't use that terminology, but we're talking about, I'm just giving you some landmarking perspective. The thumb is 1, the index finger is 2, the middle finger is 3, the the ring finger 4 and the little finger 5. But from here on in, I'm just going to refer to them as digits 1, 2, 3, 4 and 5. And then, of course, off the metacarpals come the phalanges. So we talk about the phalanges as proximal, middle and distal of the 5th. Same for the 4th, same for the 3rd, same for the 2nd. But the thumb, the 1st, is only a proximal and a distal phalange. All right, so let's have a look at the muscles that actually have effect on the wrist. The first one's the wrist and the hand, I apologise. The first one is extensor carpi radialis longus, and it's from the distal third of the lateral supracondylar ridge of the humerus. Now again, You don't need to remember origins, insertions. You certainly do need to remember actions, and we're talking about from the humerus all the way down into the base of the second metacarpal and into the third as well. And they talk about a slip into the third, but into the second metacarpal, the base of the second metacarpal, and also the base of the third metacarpal as well. So it's obviously going to extend the wrist when it contracts, but it will also radially deviate. Now, it's important to keep in mind that in this position, radius is here, and so radial deviation will be movement of the wrist and the hand in that direction. In other words, towards the radial side, not towards the ulnar side. Extensor carpi radialis brevis, from the lateral epicondyle of the humerus all the way down into the base of the third. Sorry, I'm just going to check, longus and brevis, to the base of the third metacarpal and into the posterior aspect of the second. Going to do the same sort of thing. It's going to be involved in wrist extension and radial deviation. Extensor carpi ulnaris, it sort of gives you an idea of where it's heading. Lateral epicondyle of the humerus, lateral epicondyle of the humerus down into the base of the fifth metacarpal. So it's going to extend the wrist and ulnar deviate. So we're looking obviously at the ulnar here because the radius is over here. So this is in a pronated hand. And as a result then, it's going to ulnar deviate, bring it towards the ulnar side. Flexor, so we're on the forearm. So your extensors are on the posterior in an anatomical position. Your extensors are on the posterior aspect of the forearm. And the flexors primarily are on the in an anatomical position on the anterior aspect of the forearm. So we'll talk about flexor carpi radialis longus from the medial epicondyle of the humerus, down into the base of the second metacarpal. So it's obviously going to flex the wrist, but it is also going to radially deviate, so move it in this direction. So radial head here, move it in that direction. Palmaris longus also on the flexor side of the forearm, so on the anterior aspect from the medial epicondyle of the humerus down into, it's actually a fascial adherence through the hand. It's referred to as a palmar ponderosus and flexor retinaculum, so it's obviously going to flex the wrist. Flexor carpi ulnaris also on the anterior aspect of the, or inserts into the anterior aspect of the hand, specifically into the base of the fifth metacarpal and the pisiform and the hook of the hamate, right? So pisiform and hook of the hamate. And as a result then, and from the medial epicondyle of the humerus, it's going to flex the wrist and also ulnar deviate. So that's the radius here. This is the ulnar. It's going to ulnar deviate the wrist and the hand. Flexor digitorum superficialis is as it sounds. It has two heads actually, a humeral ulnar head and a radial head. So humeral ulnar and radial head, and into the base of the middle phalanges, although this sort of looks like it's to distal, you can't really see, but into the middle phalanges of 2 to 5. So we know that's 1, 2, 3, 4, and 5. And so it's going to obviously flex the wrist and also flex the interphalangeal joint, so flex the hand essentially, or the fingers of the hand. Flexor digitorum profundus, medial and anterior surface of the proximal 3/4 of the ulna. So again, radius here, ulnar here, proximal 3/4 of the ulna, into the base of the distal phalanges, so 2, 3, 4, and 5, and so it's going to flex the phalanges. It'll also be a weak wrist flexor because it does cross the wrist. Flexor pollicis longus is as it sounds. It's into the pollicis means the thumb. It's from the anterior 2/3 of the radius and the interosseous membrane. So there's a membrane that typically unites both the radius and the ulna, and it attaches into that, and then to the base of the distal, because it's got the thumb crossing, it makes it hard to see, base of the distal phalanx of the thumb, and it obviously flexes the first interphalangeal joint, and again would be a weak wrist flexor as well. The extensor digitorum, so we're moving to the posterior aspect. This is a posterior view of the forearm from the lateral epicondyle, obviously in a pronator position here, the lateral epicondyle of the humerus into the base of the distal phalanges of 2 to 5. So 2, 3, 4, and 5. Extends the digits of 2 to 5 and also assists in wrist extension as well. Extension of the digiti minimi is as it sounds into the minimis into the small finger, so lateral epicondyle of the humerus, the base of the fifth distal phalanx via the extensor expansion. This is also a fascial sheath as well, but because it goes into the base of the distal phalanx of the fifth, it's going to extend the fifth digit. And again, because it crosses a wrist, it'll be a weak wrist extensor as well. Extensor indicis, and you can see where it heads. It's into the base of the second distal phalanx. It's coming from the ulna, and therefore it's going to be a weak wrist extensor, right? Extensor, this is radius and this is ulna. It's going to be a weak wrist extensor and also extends the second digit as well. Extensor pollicis longus, posterior surface of the middle third of the ulna, right? So again, we're in a pronator position here, ulna. Base of the distal phalanx of the first digit, so the thumb, so it will extend because this is a posterior aspect of the wrist itself, so it's going to extend the distal phalanx and be a weak extensor of the wrist as well. Extensor pollicis brevis, very similar, except it's going into the base of the first proximal phalanx rather than distal phalanx. Or phalanx, so it then extends a proximal phalanx of the thumb. Excuse me, abductor pollicis longus, so into the base of the first metacarpal coming from the ulna. It has attachment to the radius as well and to the interosseous membrane, but you can see from this that it will abduct, so it's going to move in this direction, the first metacarpal joint. All right, now we get right down into what are referred to as the intrinsic. So they start in the hand and they finish in the hand. Palmar interossei, the shafts of the metacarpals of 2, has got 3 in here, but 2, 4, I apologise, it's not 3, 2, 4, and 5. And then into the base of the proximal phalanx. So it's going to adduct. Now that means bring the digits together. So abduction of the digits is away from each other. Adduction of the digits is towards each other. Sorry, I apologise. Dorsal interossei are, as they sound, the shaft of the metacarpals of 2. Where are we? 2, although that looks like it's attached to 1. This is 2 here. It's got an attachment at 1, but it's 2, 3, 4, and 5. So base of the proximal, the shaft of metacarpals 2, 3, 4, and 5. This is not accurate. To the base of the proximal phalanx and extensor expansion. Now, you can see that this is an anterior view in the anatomical position, but it goes into the extensor, so it sort of starts in midline anterior and then runs posteriorly. It will abduct the digits, so spread the digits out as a result. The lumbricals are intrinsic, so start in the hand and finish in the hand. So tender of the flexor digitorum profundus. So it actually attaches into the tendon of another muscle, digitorum profundus, and goes into the lateral aspect of the extensor expansion. So it also starts mid-shaft and then attaches posteriorly. So it's going to be involved in metacarpophalangeal, so these are the metacarpals here, flexion, and interphalangeal joint extension. So it's going to extend the distal interphalangeal joint because it extends posteriorly into the expansion tendon. It will extend the phalanges. All right, need to have a chat to you about the carpal tunnel. Now, the carpal tunnel is a reference to the tunnel created through the wrist itself. So if you look at, we're looking at a cross section of the wrist, and we're looking at the metacarpals here in the base of the wrist. So triquetrum, hamate, capitate, and scaphoid. I apologise, and as a result, then, and sorry, I apologise, pisiform up here as well. So, if you look at the cross section, you can see that the bones, the carpals make up what are called or referred to as the floor of the carpal tunnel or the carpal area. There is what's known as a transverse carpal ligament across the top, which then creates this tunnel through which, so this is the floor, this is the roof. So the carpals make up the floor, and the transverse carpal ligament, often referred to as the flexor retinaculum, makes up the roof. Now, as a result then, all of the flexors of the forearm, which are in blue here, and the median nerve will run through that tunnel. In other words, inferior to the transverse carpal ligament, but superior to the carpal bones. What that makes them is susceptible to impingement. So, for example, the median nerve can be impinged. For example, if there's inflammation in any of these tendons, it can impinge the median nerve against the roof of the carpal tunnel, which is the transverse carpal ligament. But you need to think about this in a three-dimensional fashion. So what do I mean by that? Well, if we're looking at the carpal bones here, you know we've got a proximal and a distal row. And so distally, we also have another tunnel created by other structures. So this is the carpal tunnel. The key component within the carpal tunnel is the median nerve and the flexor tendons. I'll say that again. The key components within the carpal tunnel are the median nerve and the flexor tendons. But as I said, remember, this is a three-dimensional scenario. So this whole area is the carpal tunnel, right? There's a flexor retinaculum. And we know the median nerve comes up through here and can be compressed against the flexor retinaculum. Now, the median nerve innervates the thumb, second and third digits primarily. But within that tunnel, within the carpal tunnel, distally there's also another tunnel, and that's made up of a fascial connection, what's known as a tendinous arch of the hypothenas, which connect the pisiform medially and also the hamate, specifically what's known as the hook of the hamate, laterally in the hand, laterally in the hand. So the medial, I apologise for that. The medial border, which is closest to the medial aspect of the hand in an anatomical position, so supinated, right? So this is supinated, the hand here. The medial board is going to be the pisiform. And in the distal row is going to be the hamate, right? So the hamate is lateral. The hamate is lateral to the pisiform. So pisiform here and hamate here. So the hamate is medial to the pisiform. There is a tendinous arch that connects the two. Now the ulnar nerve runs through there. So there's a second tunnel within the carpal tunnel as a whole, and it's up here. All right? And so that is referred to as a tunnel of Guyon. Now, if there's compression of the ulnar nerve through here, then it creates symptomatology in the fourth and the fifth digit. So remember, the median nerve, if it's compressed, the median nerve will create issues in the first, second, and third digits. First, second, and third, because median nerve runs through here. Compression to the ulnar nerve will create that issue through the fourth and fifth digits. And that can include things like weakness, it can include numbness, tingling, those sorts of things as well. All right, I'm going to leave it there.